The professional identity of athletic trainers by the public has been an issue facing us since the 1950s. Early in our history, we were known simply as trainers. In the 1950s, our title was changed to athletic trainer to distinguish us from the horse and boxing trainers common in that day. In the 1970s, our Canadian colleagues changed their name to athletic therapists to further distinguish themselves as allied healthcare professionals. Still today, the athletic trainer is associated with fitness. Hindering perception is the lack of the public's interaction with athletic trainers. According to a 2014 NATA study, only 37% of the nation's high schools have an athletic trainer. We have tried for years to change the public identity of our profession from a fitness to a healthcare profession, yet recent surveys still show the public thinks we are fitness pros. Athletic training is recognized by the American Medical Association as an allied healthcare profession. Our goal has long been to be perceived as a healthcare provider. How can we produce this change in the public's perception of what we do? In the book Switch, How to Change When Change is Hard, Heath and Heath outline 3 strategies to direct difficult change. They use a word picture of a rider directing a large elephant down a path. The rider, which is the rational brain, directs the massive elephant, the emotional brain, down a path, which are the circumstances or situations in life. Changing the public perception of the AT profession from fitness to healthcare providers is a hard change. Reasoning needs direction, emotions need motivation, paths must be shaped. Our profession understands the athletes we interact with the most have the greatest understanding of who we are and what we do. Even among NCAA Division I and Division II athletes, there is a direct correlation between access and interactions to perception of healthcare professionals. Athletes with consistent access and regular interaction with the AT had a higher perception of the AT as a healthcare provider than those who didn't. Access and interaction with the AT develops understanding of the healthcare provider role of the athletic trainer. To improve our professional identity, individual athletic trainers need to take several proactive steps. The first step an AT can take is to change the internal voice. I am a healthcare provider should be an internal affirmation statement often repeated. An AT is an expert in athletic healthcare, and we need to carry ourselves and remind ourselves of such continuously. Second, we must dress professionally. In a survey of California's secondary school athletic directors, professional competence of an AT was perceived differently based on their level of attire. If ADs have had this perception, presumably the general public will too. Dress for success. A third step is to see every professional interaction as an opportunity to project the desired professional image. This requires positive body language, confidence, and professionalism. The lack of public's perception of the athletic trainers is incredibly frustrating and overwhelming. For decades, we have fought this battle and seen little progress. Something must be done, but what can be done? Does a lack of national initiative prevent a grassroots initiative? The obvious answer is no. In a 2010 TED Talk, Rory Sutherland brilliantly presented how little changes produce the largest change. This problem is not a national initiative problem. It is requiring a large budget. It is a big problem that will change by small, consistent habits. The AT's identity can and will be changed by the collective actions of the individual more effectively than the actions of the NATA. While you can't affect change at the national level, you can in your own community. Rather than focusing on the national problem, tackle changing your community's perception of who you are, what you do, and why you do it. If all ATs were to project a professional image accessible in their communities, and be a constant presence, in a few years, a vast majority of the public will identify as a healthcare provider. Changing the community's perception of what we do seems like a daunting task. One constant phrase coaches say to injured athletes is, "Go see the trainer." The student athlete reports to parents and friends, "I saw the trainer." The issue of our professional identity is often wrapped up in being called trainer and being confused for a fitness professional. I get it. Athletic training is harder to say than trainer. Rather than athletic trainer, let's make a push to be referred to as AT, just like a physical therapist is called a PT. Educate the coaches and administrators to refer to you as the AT, and to tell injured athletes, "Go see the AT." A simple sign on the athletic training room door that says, "Call me AT," could be effective in changing the title. This subtle change removes the connotation of trainer and being in the fitness industry rather than in healthcare. Conduct yourself as a healthcare professional. The AT room is a healthcare clinic. The athletes are your patients, and you are a healthcare provider. This internal dialogue changes the environment around you as you interact with it. So how do we measure change? How do we know we are making a difference? The public perception of the skill set of ATs is still entrenched in fitness rather than healthcare. ATs should seek to improve public perception to healthcare providers so that greater than 75% of surveys reflect the perception of a healthcare professional and not with fitness. Since access and interaction improve perceptions, we should seek to have 75% of the nation's public schools provide athletic training services for the athletes. Once we have achieved these goals, we know we are well on our way to changing the public's perception of athletic trainers as healthcare providers. Thank you.